Yes, if I to just also make it very simple in layman's language, if you look at the molecular test and the protein test, basically it's to detect the virus in the nasopharyngeal fluids. Simple as that. So they all require swabs, and it's all to detect the virus. The molecular test basically uses a molecular probe, which is an RNA probe. The antigen test uses an antigen antibody test. That's as simple as that. So one is a molecular test looking for the virus with a gene probe effectively, and the antigen is looking for the virus with a protein probe. Simple as that. So originally what you tend to find, because this is a PCR method, PCR methods are usually in molecular biology labs, molecular pathology labs, and they usually have to be of a certain level, biological safety level, usually biological safety 3. So if the average PCR machine is in a lab that has that level of requirement, and that's what traditionally we all know. Although one has to add that there are newer moves with smaller devices at the moment, but that's yet to be seen, and that's something we're looking at. But you're right, the traditional PCR labs are molecular pathology labs, and they're usually in specific centers. Not every single lab, for example, has requirements and is able to meet a molecular biology lab.
Whereas the antigen and the antibodies, they're done in more routine, what we would call a routine laboratory, and they're quite plentiful, those different labs. So basically the PCR is they've got a tiny bit of molecular material, and they have to actually amplify it, and so that takes a couple of cycles of doing it. And then once they've amplified, and if it's there, it gets amplified to such a level that they can actually detect it, and that takes quite a period of time. Whereas the antigen test is done within sometimes 12 minutes, compared to the other one, which so the two disadvantages of it is that it actually has to get to the site too, which is, and then there's a bottleneck at those sites. And so the instruments because they're not as quite a routine approach, that their capacity, they're not really used to that type of capacity that the COVID situation has caused. But just how long would an amplification normally take?
What you're getting with the kind of amplification of this, traditionally they're probably now 2 to something like 4-6 hours there on the meeting block. But actually what you're getting is some newer machines and some machines coming out as saying they can get it down to about 1 hour, 1.5 hours. And that's just the amplification time.